The Digestive Disease Center at the University of Chicago Medicine exists as a collaborative and multidisciplinary group of individuals and research staff who together are delivering outstanding patient care at the same time that we're asking critical questions about how we can change the way we do things and advance the science of digestive diseases.
Multidisciplinary care is really the best way to deliver the optimal care for a patient and achieve the optimal outcome. No longer is just one modality, whether it be surgery, chemotherapy, or radiation therapy, really effective for any complex malignancy. In this day and age, the best outcome is achieved when we all work together and deliver our modalities together as a means of obtaining the best outcome.
The Inflammatory Bowel Disease Center at the University of Chicago has existed for over 60 years. It's a program that has dedicated itself to providing outstanding patient care to patients who suffer from Crohn's disease and ulcerative colitis, and for our colleagues, a center that welcomes referrals for consultation, where we can provide a multidisciplinary approach to these patients' care and an assessment not only of their complexity of illness, but also provide them with a range of treatment options from advanced standard of care and cutting-edge approaches to, very importantly, clinical trial and translational science aspects of their management. The Inflammatory Bowel Disease Center is part of a larger network of all the different groups that work within digestive diseases.
The Center for Endoscopic Research and Therapeutics, we're focused basically into three different areas. One is novel imaging technologies, then minimally invasive endoscopic therapies, and the cancer staging and palliation. We are offering patients an alternative minimally invasive way to deal with their particular digestive problems, whether it is an early tumor of the gastrointestinal tract to palliation of problems that otherwise would need big surgical procedures. In addition, our focus of interest in novel endoscopic technologies, we're actually trying to identify precancerous problems even before they are noticed with an endoscope. We start where diagnostic endoscopy ends.
At the University of Chicago, we have a comprehensive program in small bowel disease and nutrition. That includes the care of patients with celiac disease, malabsorption, diarrhea, and a team approach to providing specialized nutrition care in those who require tube feeding or IV feeding. We're involved in clinical studies to advance care in celiac disease. Besides the gluten-free diet, which is the standard of care, we are looking at enzyme therapy that could prevent ingestions of gluten when patients travel. We are also trying to set up other studies to look at therapies for individuals with refractory disease.
The Center for Liver Disease, our major focus on research is in hepatitis C therapies. We have been instrumental and one of the leading centers nationally in testing new treatments for hepatitis C and bringing these new therapies to our patients.
In our Pancreatic Disease Center at the University of Chicago, we have a strong interest in patients with pancreatic diseases. We mainly treat patients with complications from pancreatitis. We see a significant amount of patients with pancreatic diseases like chronic pancreatitis, many of which have underlying genetic mutations. Here, we are one of the few institutions in the United States doing a very complicated procedure called total pancreatectomy with auto islet cell transplantation. And here we do, particularly in patients with genetic conditions of the pancreas, will remove the entire gland to treat debilitating pain and then put the cells that make insulin back in the liver to prevent the development of bad or difficult to treat diabetes.
The research we perform in the Digestive Disease Center related to GI oncology involves research focusing on molecular genetics, viral gene therapy of GI malignancies, as well as clinical trials that focus on specific GI cancers in a way to provide the best forms of treatment for our patients. The center is a comprehensive center for patients with GI malignancies. Our operating rooms are equipped with a state-of-the-art means of providing the best surgical care for these patients.
Patients who have digestive diseases don't come to us and know that they need to be seen by a specific specialist in a specific corner of a specific building. For a patient who has a disease, they need access to all the specialists from any area who can come together to take care of them. We're removing all the barriers and walls from the way we see patients and bringing everybody together around the patient. So everything gets back to our concept of you start with the patient and you build everything around them.
The ability to take every patient, to tailor therapy for that specific patient. Multidisciplinary at every point in time now. The future for the Digestive Disease Center is really personalized care.
What we really believe is that if you build everything around the patient experience can be much more satisfying to them, but much more productive in terms of getting them the diagnosis they need and setting them up with the treatments they need. On behalf of all of my colleagues at the University of Chicago Medicine, I want to welcome you to our beautiful city of Chicago and to Digestive Disease Week. The University of Chicago campus is just a few miles away, so if you have an extra few minutes or if you have an extra day, come down and visit us. We're really proud of our city and we're really proud of our institution, and we're glad to have you.